Good morning. I'm moving the camera here because I noticed there was a glare. So good morning. Today we are going to talk about when ice is nice and hot is not. What do I mean by that? We're going to talk about when it's good to use ice and when it's not good to use heat. My name is Dr. Jeanette DeWitt. I'm a physical therapist, an athletic trainer, and a fitness coach. The reason this topic is so important is because I have patients, I have clients, I have people just asking me, when should I use ice and when should I use heat? And I will tell you that ice is nice and hot is not in the first 72 hours of an injury. For example, this morning, not kidding, this morning I was putting on my shirt and I guess I was too close to the wall and I just whacked my elbow into the wall. And it really hurts. It's not that I didn't have numbness or anything in my hand, but I definitely whacked my elbow, not my funny bone. And it really, really hurts. So I would not apply heat or hot to this area because now, excuse me, now it is inflamed. And I actually have some swelling sitting on the bone of my elbow. But I did apply ice. And the first 72 hours, it is crucial to apply ice to cut down on swelling in the area as well as in the surrounding area. So let's just take my elbow for an example. So I hit my elbow right here and right onto the muscle area where the triceps muscle comes in to the elbow. In the first 5 minutes, it is important to add ice and apply ice because not only are you going to reduce the swelling and the pain and the injury to the area that would actually is the primary source of pain, which is my elbow, but it's also going to prevent the surrounding muscles and the surrounding tissue from getting inflamed as well. Let's talk a little bit about what happens when an injury occurs. You will have an initial area or the actual area of injury, the root cause of the problem. So let's just say it's either bone or a ligament or a muscle. That area is injured. You also have the surrounding muscles, ligaments, bone, and fascia, which is the connective tissue that holds everything together. That area can get injured too. It is absolutely normal for swelling or inflammation to take place. You actually need that to happen because that's the body's way of bringing nutrients to the area and then getting waste products out of the area so that that area can heal. But you don't want it to get out of control. And when that happens, you get chronic inflammation and you get a tissue area that doesn't want to heal. That's why it's so important to apply ice and reduce the area of injury and reduce the amount of swelling that comes into the area. So when ice is nice and hot is not is in the first 72 hours after an injury. After that 72 hours, if you still have swelling, you want to just stick with ice. If you no longer have swelling and it's more of an achy type of symptom, you may be able to apply heat. However, if you are in doubt, apply ice. Now, for chronic situations like a low back strain or a muscle tightness or arthritis, heat can work very, very well, but there's no visible swelling that is present and the area is not warm or hot to touch and there's no redness. These are the hallmark signs of when you should not apply hot. Let me go through that real quickly again. In the first 72 hours or when swelling is present, add ice or apply ice. If the area is swollen, red, or warm to touch, do not apply hot. Enjoy your day. I hope this tip is helpful. The next time that you have an injury occur, things happen. I hope that doesn't happen to you, but life is life, and aches and pains happen. The next time something happens in the first 72 hours, go ahead and apply that ice. Thanks a lot.